Did you ever have an imaginary friend as a child? Maybe a couple imaginary friends who could keep you company when no one else could? Imagine living with these friends every second of every day of your life. That's what schizophrenics suffer. Schizophrenia is a severe mental disease. And the reason why I'm talking about schizophrenia is because I have an interest in psychology, and schizophrenia is one of the many personality/mood disorders that interest me the most. Today we'll be talking about the symptoms, the causes and effects, and the possible treatments of schizophrenia. Although the severe mental disorder is frightening, it cannot be cured. But there are many treatments that are possible for those suffering schizophrenia. According to the University of Pennsylvania Health System, schizophrenia affects mostly the memory part of your brain. And Patrick Young, the author of the book Schizophrenia, states that schizophrenics often lose touch with reality through this disease. There are three categories of schizophrenia. These include the positive, the negative, and the cognitive categories. The National Institute of Mental Health stated that hallucinations and delusions are the most common symptoms of schizophrenia, and hallucinations and delusions fit into the positive category of schizophrenia. Hallucinations are when the person suffering the disease will often hear, see, or even feel a person that they are imagining, and no one else can see these people. Delusions are a little bit different in the sense that the schizophrenic will believe that they're a famous person or above everyone else, and they believe that what they're thinking is completely true and everyone else is out of their mind and false. Negative effects include a flat affect, which is when the schizophrenic shows no emotion, no inflections of voice, and they have a lack of joy and pleasure in their everyday life. They often become introverted and will even neglect their personal hygiene and family. The cognitive portion of schizophrenia is when the sufferer will not be able to make decisions on their own, and they often have times understanding what other people are trying to tell them. They also have trouble focusing or paying attention, and they have short-term memory. The effects of schizophrenia are often shown in the ages between 16 and 45, although schizophrenia in children is increasing. The effects and causes of schizophrenia can be genetic or might even be a mutation in DNA, but scientists have not found this out yet. Discover magazine declared that schizophrenia is probably genetic, but if it is caused by a mutation in DNA, it may be from the transfer of dopamine in the brain, which is a chemical that helps cognitive learning and can cause the hallucinations and delusions of those with schizophrenia. Oftentimes, people will develop the disease in their late teens and early 20s, and if they do not contract the disease by the time they're 45, they are pretty much safe from getting the disease in the sense that it stops developing after a certain age. Schizophrenia can cause family distress, and no one knows why it is caused, but there are theories. According to the Mayo Clinic staff, schizophrenia can be treated with medications or even therapy and admittance to a mental hospital. There are many different kinds of medicines that can be used for schizophrenia, but if one does not work, the scientists and doctors keep having to try more to try and kind of calm down the symptoms of schizophrenia. And if the disease gets severe enough, those suffering might have to be admitted to a mental hospital, which can mean life in the hospital because they are often too severe and trapped in their own mind that they cannot be put back into the public eye or even with their families. Therapy can help the schizophrenic in the way that a therapist or psychiatrist can help them understand what's going on in their mind, but most times the schizophrenic does not want to believe it because they have voices and the people that they're imagining in their head telling them that they are right, no one else can tell them what to do. So this disease is very severe. Even though schizophrenia cannot be cured, there is hope for those suffering the disease. And while it's scary to think about, schizophrenia is a very interesting topic to learn about, and more people should be aware of the signs and symptoms to be able to detect the illness as early as possible.